from one of our guests today. We have Dr. Abdel Rahman. He's saying that what key performance index do you care for the most for your MSL team?
It's a great question. KPIs are always a interesting topic to cover when you're talking as an MSL leader, right? What we do in medical affairs, especially in field medical, is it's not a direct line between every day what we do and how the company is making a profit, right? There's a lot of nuances there, so there's a whole ton of things. But for me, I think my personal preferred KPI is insights, right? Because that's that bi-directional sharing of information. MSL stands in front of a thought leader, is able to have a conversation, scientific exchange, but they're using their ears and their brains and they're pulling back information that will help the strategy of the company. So they have the potential to make a very direct impact on where we go as an organization, whether that's something as simple as a new educational resource or new something else that we train the team on, or is it something bigger that's going to lead to a new data generation idea or discovering that, hey, this marketing strategy that they have is definitely not landing and we need to reevaluate that looks like. So I think there's many ways that the insights that they gather can have a direct impact on the company. So to me, those are the most important KPIs. That said, obviously, you need to have interaction metrics. You need to know if you're not out there numerically, you're not making an impact. But at the same time, you could have a lot of interactions, but only two of them are actually getting you anywhere well. Or you could have an MSL with fewer interactions, but has super quality and they're really having a big impact on clinical practice. So I think there's a lot of different ways. But for me, it's quantity, but it's also quality. And the